is Kay Nikiforova. I use they, them pronouns. I'm head of clinical at Violet. Thank you for joining us for Care Homes for LGBTQ+ Identified People. We're going to be talking about effective healthcare for LGBTQ+ individuals. And one of the things that I wanted to say is oftentimes for LGBTQ+ panels or focused on LGBTQ+ care, there's a lot of focus on the community, and I think that's very important, but I think it's also important to acknowledge that trust, affirmation, being seen by a clinician is actually a human piece and is a human issue and something that we all face based off of our identities. It feels good to walk into a clinician's office and feel like they understand us and also feel like we don't have to explain ourselves. And so while we're going to be talking about some specific LGBTQ+ issues in terms of healthcare disparities, the recommendations in this panel actually expand to everybody. And so as a really quick opening, one of the things that I'd really like to do is share an anecdote from this morning to talk about why this is important. And so this morning I was on a Facebook group. It's a 10,000 person Facebook group for LGBTQ+ individuals. And one of the top posts was, I am a person who needs a primary care provider, and how do I find one that won't misgender me? So I just want to acknowledge that. This individual went to that Facebook group asking for a safe clinician. What I want to acknowledge is earlier in this year, when I also had some healthcare issues, I also went to that Facebook group. I have insurance, I have a lot of different access to care, and yet I really wanted to find a clinician that saw me as a person. And so one of the things I just wanted to say is it's really important for individuals like me to be able to get care that we deserve, and also focusing on the tech that is going to be able to help us do that. And so I really wanted to spend a little bit of time introducing our panelists, and so I'm really excited to finally meet in person. We've been on different iterations of panels during COVID, have never met in person. And so I just wanted to introduce Dr. Jerica Kirkley, and would you be able to give a little bit of introduction?
For sure, yeah, thanks Kay. Really excited to be here at this conference, and especially alongside Kay and Colin, who are doing amazing work. So I'm Jerica Kirkley, pronouns are she, her, and hers, and I'm the Chief Medical Officer and co-founder of Plume. And Plume is a company that I helped co-found. That's the first health technology company completely dedicated to the transgender community. And so we provide virtual gender-affirming care services, so medical, prescription, non-prescription services to the trans community. We're in 33 states right now and expanding both geographically and also in the scope of services that we provide. A little bit about myself. So I'm a trans person myself and have gone through my own gender journey and experience alongside many of my patients through the years, but I've been practicing gender-affirming care for about 10 years now, and largely in the federally qualified community health center setting, so have been in the health equity world for a long time, pretty much since I got into medicine. That was one of the reasons that I got into medicine in the first place, because really saw healthcare as a vehicle for social justice and a lot of potential there. And so, so my journey as a physician providing gender-affirming care and as a trans person myself has brought me to this space. And yep, thanks for having me.
Thank you so much. And also, I wanted to introduce Colin Quinn.
Thanks, Kay. Good afternoon, everyone. My name is Colin Quinn. I use he, him pronouns. I'm the president of Included Health Communities, which is our care equity programs focused on underserved member populations. Our first product was or is for the LGBTQ+ community, and our second product is for the Black community health population as well. What we do at Included Health Communities is focused on raising care equality for our underserved member populations through our tailored solutions via our advocacy and navigation services. Why I'm so passionate about this is really rooted in the challenges I've had navigating the healthcare system as a gay man. I've had my own struggles finding a primary care doctor that was a good fit for me and that created a safe and welcoming environment for myself to show up in. I've been denied services, and all of these things. I come from the healthcare community. I've been in healthcare my entire career. I thought I knew how to advocate for myself, but I was still having these struggles and challenges, and had the opportunity to speak to so many other friends, colleagues, and also HR benefits leaders, and understanding how are they thinking about providing solutions and services for their employees as well. I think as we've heard some of the previous groups and panels talk about, whether it is COVID and the pandemic or the cultural awakening after the murder of George Floyd, 2020 was really an eye-opening year for many. So it's an opportunity to raise these conversations to the forefront. DEI and inclusive benefits is a top 1, 2, or 3 priority for so many. So excited to be having this conversation. Thank you to all of you who have shown up to listen, and excited to continue it even beyond this as well. So thank you.
Thank you so much. And my name is Kay again. I use they, them pronouns. I'm head of clinical at Violet, really the first platform which is benchmarking, badging, and educating clinicians in cultural competence across different communities. Right now, the 3 communities that we're focusing on are BIPOC individuals, TGNC individuals, and LGBTQ individuals, with the intention of really greatly building that out. The intention is to really create identity-centered healthcare journeys for everybody, regardless of their identities, and to be able to find the clinician that really can work best with that individual. I have training as a clinician and also as a researcher, with a lot of my research focused on LGBTQ+ research and healthcare disparities, and also research stereotype, which I'll probably be throwing in there a little bit. And also come from lived experience. I'm a queer, genderqueer immigrant, and as I mentioned, I've had my own healthcare journeys, and so it's really great to be able to bring that in here. And so to start, just to give it a bit of a background, I wanted to talk about some of the biggest healthcare disparities for LGBTQ+ individuals, and so just kind of open that up in how you wanted to talk about that.
Sure. Yeah, and one thing I'll say, so the LGBTQ+ community is entirely broad, right? And my area of expertise and work is really focused on the trans community. And just to preface that a little bit, when I say trans or transgender, that is a very, really an infinite spectrum of gender identity, right? So you might hear trans, transgender, non-binary, gender non-conforming, and it's all of that, right? So it's any spectrum of gender identity. Same can be said throughout the LGBTQ+ community when it comes to sexuality and other aspects. But I think, when we think about disparities, there's a lot of statistics out there, right? There's certainly resources you can go to. In the trans world, the U.S. Trans Survey, USTS, the last came out in 2015, so it's already 6 years old, but there's certainly a lot of things that get highlighted, right? Lack of access to primary care providers, lack of access to gender-affirming care, specifically like hormone therapy or surgeries if needed, and just overt discrimination in the system, right? Up to 1/3 of trans folks are actively discriminated against in a healthcare facility. Black trans femme folks who are 5 times as likely to get HIV as the general population, which is hard to believe that that's happening, in our country. And so there's lots of statistics, and I think what I always like to start with is, talking about the patient journey. And again, I'll speak specifically to the trans experience, since that's where I do my work. But I think the thing to remember is that it starts before you leave. Well, as you leave your door, And one just example this morning, right? So I'm taking the shuttle from the hotel to the conference center, and I'm misgendered on the shuttle. As I'm on the shuttle, the only thing I can think about is where are the bathrooms going to be in the facility, and how are they going to be labeled? And it goes on, right? So there's many things that a person will interact with before they even get to the door of the clinic, but then they still have to go through a receptionist, a medical assistant, fill out paperwork that may or may not acknowledge them appropriately, a nurse, a clinician, a phlebotomist, a pharmacist, and the list goes on, and they have to do that all again as they leave and come back. And so there's a lot of points in the system where discrimination can occur, that can be dysphoric, and we'll talk a lot about how we're changing that, but I think that's just always something to remember, when it comes to those disparities and how they actually present themselves on a day-to-day basis for folks.
Yeah, and just adding to that, as Jerica mentioned, there hasn't been a whole lot of research done on our community from a healthcare perspective. When we were starting from an included health communities standpoint a couple years ago, it was really important for us to start and understand what is the current healthcare experience like for our community. What are some of the challenges that we're having and seeing? What would we like our healthcare to look like? So we actually started our own research study where we partnered with a handful of Fortune 100 companies and we surveyed their Pride ERGs. So it was really looking at their LGBTQ plus workforce to once again understand what does the current healthcare experience look like, what are some of those challenges and gaps in care. And it was really the first of its kind study because once again, as Jerica mentioned, there really isn't a whole lot of data and research out there for our community. It might be regional or very specific on a disease state or a specific need or experience. So we really wanted to understand broadly what does it look like. We got about 2,000 survey responses, so a very large data set. And what we learned is quite alarming, to where kind of breaking it down into 3 buckets. Our community is struggling to access providers that meet our needs, that are both affirming and clinically competent. As Jerica mentioned, it's extremely important that we are identifying both of those things together. So not only are the providers creating a safe and welcoming experience for members, but also they're aware of the clinical needs and the health disparities to ensure it is a good quality outcome. So really identifying and understanding the access pieces, where 45% of members are saying, I've had difficulty finding a primary care doctor. 60% were having difficulty finding a mental health clinician. And then looking at the experience piece, similar to what Jerica mentioned, rampant rates of discrimination, care being denied. As a result of that, members of our community are actually postponing and avoiding care. So we oftentimes talk about our community being a hidden high-risk member population, because you necessarily can't go into the claims data and isolate who is LGBTQ plus and who is not. You can maybe look at a couple pharmacy codes or a couple surgical codes, but for the large majority, we're hidden in there, or we just don't show up because we're not going to the doctor. And then thirdly, looking at outcomes. Unfortunately, all of this, lack of access, poor experience, leads to worse health outcomes, higher rates of certain types of cancers, certain types of illnesses, HIV, of course. We want to make sure that members of our community are aware and being treated, and from a preventative care through PrEP, but also mental health is a huge unmet need within our community. Across all communities, recognizing that mental health is an unmet need, but our community is disproportionately impacted from a mental health perspective as well.
Yeah, thank you so much for that. And first I want to say, yeah, it's really important to acknowledge that the LGBTQ plus community is not a monolith and has many communities and sub-communities and intersections of communities. And so it's really difficult to talk about the communities as a whole. And one thing that I wanted to do is kind of on my end, I think it really starts with the healthcare system was not built for LGBTQ plus patients. It actually wasn't built for most individuals outside of a very small subsection of the population. And so the healthcare system wasn't built for this. And then also the research that informs healthcare wasn't created with LGBTQ plus individuals accounted for. And so one of the things that I've seen, at least in the research that informs clinical care, is it's really deficit-oriented. It's really oriented toward kind of what is wrong versus how can we make better choices and what's right. And what that creates is oftentimes clinical stereotypes and research stereotypes, where oftentimes the LGBTQ plus community gets, the conversation is specifically STIs or specifically HIV and AIDS, and there are so many other things that are affecting our community. And so how do we expand beyond that toward understanding how we can really help an individual be healthy rather than really focusing on risk? And so I think that's a really good segue into talking about how we can design a better healthcare journey for LGBTQ plus individuals, also through a bit of a strength-based orientation.
Yeah, I mean, and just to tag on to that, and I think this is also a good segue with the segue, is, it's made me think about education, right, as one of those key pieces of where structural inequity exists. And is a point where you can start to really change the system as well and change that journey, because yes, these inequities exist because of stigma, discrimination, there's no question, but also because it's not a standard part of health education for our healthcare professionals, right? You name any professional school, medical school, nursing school, social work, physician assistant, et cetera, LGBTQ plus care and really specific aspects of that is not focused on, standardized at least. So, I think how we're educating our clinicians, I mean, the awesome work that, y'all are doing at Violet, and hopefully even getting earlier on in those schools of training, I think is where we can really start to make some change, but that's a long process, right? Mm-hmm. We're talking about, generations of individuals to go through these systems, sometimes 7 years of training, as a physician, to start seeing patients. And so one thing I think, we think about at Plume is yes, we're providing direct service to patients, but we're also training a workforce, and I think we recognize that the power of telehealth to reach a really distributed population as patients and members, but also the power of telehealth to reach a distributed community of healthcare practitioners and to bring folks in the door, give them that experience, and train them and to really create competency that they can take back to their local communities as well. So it's just made me think of that.
Yeah, the way we're thinking about it as well is almost turning traditional healthcare on its side. So not necessarily looking at it from a therapeutic or disease state perspective, but really thinking about it from a population perspective as well. How do we think about engaging an underserved member population? How do we come up with tailored solutions that really speak to our members that have been discriminated against or left out of the healthcare system? I think one of the phrases that I'm hearing more and more that I love hearing is healthcare is not a one-size-fits-all approach, or should not be a one-size-fits-all approach. It's really important to understand the unique engagement aspects that we can use to engage our member populations, whether it's getting them reconnected back into the healthcare system through primary care. Oftentimes we hear members saying, gosh, I haven't been to the doctor in 6, 7, or 8 years because of a negative experience they had a long time ago. So it's just really important to understand what's the right language, what's the right engagement tactic or communication channels that we're using, but then ensuring that we have the clinical expertise in creating those safe and welcoming environments for, regardless of what the population is, but of course we're here to talk about the LGBTQ plus population. And at Included Health, really what we're ensuring, I touched on this at the beginning, but is this idea of affirming and clinically competent providers. As Jerica mentioned, up until about a couple years ago, medical school curriculum only dedicated about 4 or 5 hours out of the entire medical school curriculum to LGBTQ plus health needs and health disparities. So there's quite a few physicians and doctors that have been on record saying we're woefully underprepared to support the LGBTQ plus community. So it's really incumbent upon the providers themselves to continue to self-educate and be aware. So I think there's a lot that our solutions can do to help from a provider education perspective, but then identifying who are those providers to be that safe reentry point for so many members in our community to really change the long-term trajectory of their health care.
Mm-hmm.
Yeah.
Thank you both so much for that. And just as a reflection for myself, I've really focused on getting training with LGBTQ plus patients and especially trans patients. And I've really had to cobble together a curriculum for myself from a lot of different sources. And there isn't kind of a start to finish, this is what you need to know. And so kind of on my own journey of trying to become, clinically competent with specific communities, it's been very hard, I will say. I don't know if that kind of echoes your experience, but as a clinician trying to get that training is really difficult. And one of the things that I wanted to also jump to is that element of clinicians do want to do good, and oftentimes it's very hard to know how. And the affirmation piece is very important, but without the clinical competence, it's really hard to follow through and create situations where a patient is chastised for not going to the doctor for 7 years. And it's like, well, the last time I went, I had more trauma from that than actually getting a particular type of care.
Okay, one
please
other
go
thing
ahead.
that you sparked and I think is really important to talk about, especially as the consumerization of healthcare continues to go in that direction and members are really wanting to identify with their providers or find providers that are like them. Healthcare is so personal. So if you've got somebody who hasn't been to the doctor in a number of years or has an important topic that they want to talk about or has been discriminated against in the past, we are finding through the work with our members, but also just with all of the different intersectionalities across our community. We're a very diverse community, basically cover all races and ethnicities, sexual orientations, gender identities, but this idea of the personalization of healthcare and being able to connect members to providers that they want to be connected with from a personal preference perspective. So the idea of having pictures of the doctors or demographic information about them so members can say, yes, I would like to see a doctor or provider, of course, of this specialty or focus, but of this race or ethnicity, of this gender identity or sexual orientation. Maybe I want a telehealth or virtual care appointment instead of an in-person appointment. because it might be safer for them to take that appointment from the safety and comfort of their own home. So just being able to think about it across all of these different facets and spectrums just to ensure better engagement opportunity for members.
Yeah, I was going to say something real quick, just that made me think of, I think, so I can speak to that through the provider lens, and really is just echoing what Colin's saying. And I think what we really think a lot about at Plume is this idea of, this thesis of identity-based care or community-centered care, and, really thinking about the needs that come up with an individual community. And while this can be pretty varied even within that, I think what that looks like is, again, I come from the FQHC setting, which talks a lot about community and patient-centeredness, but it's really hard to do that in practice. And so I think what we've tried to do at Plume specifically is like really connect to the community and the individuals. And so actually creating relationships with individuals who are talking to their communities, creating relationships with a lot of different community organizations, both within and outside of healthcare, to talk about the trans experience in healthcare and how people are getting access. And so I think that's really hitting something there, and what I'd love to see, things evolving as we go along, and what I'm hearing in a lot of the sessions here today.
Mm-hmm. Yeah, and kind of the next big topic is trust and therapeutic alliance for the LGBTQ plus population, once again, just for human beings. And one of the things that I wanted to touch on is there is this movement toward identity-centered care, and oftentimes that's through shared lived experience with the clinician. And one of the things that I think is really driving that is just that using that as a proxy for safety, oftentimes, because I know if I go to a trans clinician, it's going to be much less likely they're going to misgender me. It's going to be much less likely that they're going to make not know how to give adequate care for me. And so while that's kind of a really important first step, it's also, I think, really important to acknowledge some of the clinician fatigue that can come with that. One of the pieces of feedback that I've gotten from a lot of trans therapists is their panels fill immediately as soon as they disclose their gender identity, and then they're filled, and then their friends are filled, and then they don't know where to send people. And so one of the things that I think that I've been thinking about at Violet is really how do we kind of expand that umbrella to make sure that other clinicians can also treat these communities and have that level of safety as well. And so if you could speak a little bit to trust in the therapeutic alliance, it seems like that's what
Yeah, absolutely. And I think kind of the stuff I mentioned before definitely gets into that. And I think it's, there's definitely, you have to be able to build trust in a therapeutic alliance with an individual clinician, but you really have to be able to build trust with an organization, right? And then if you start building trust with organizations, you build trust with a system. Now, historically, we've not done a great job of that as a healthcare system. I mean, I was, listening to a great session upstairs talking about, of course, a lot of the institutional biases that have occurred and with Black folks in this country, and like the Tuskegee experiment and forced sterilization, and even with the LGBTQ plus community, right? So being gay, or homosexual, as the textbooks would say, was considered a disease until 1994. Being trans was considered a disease until 2013. So this is not too far in the distant past. So there are these just like historical structures of oppression that have created a lot of mistrust, right? And so we're trying to earn that back. And how do you do that? I think it does come from an individual level, but ultimately, I think we want to see it at that provider and system level so that somebody walks in to, let's say, to Plume or to any clinic, and they know that they're in a safe place, that they're cared for, regardless of the background of that clinician. Still, of course, acknowledging that that background can go a long way and create some safety itself.
Yeah, I think it's important to recognize it's a little bit of a two-way street. So of course, the first building block is ensuring that we have a safe and welcoming experience for members. But also then, as a member of the LGBTQ plus community, it's important that we are open with our doctors to ensure that we do get the health care that we need and deserve. I was looking at a recent statistic from a clinical study that about 40% of our community is not out to their doctor. So of course there are many reasons for that. Maybe we don't feel comfortable being out to our doctor because we're unsure how we'll be treated or what that experience will be like. Maybe we're a little bit nervous about it. A lot of reasons for that, but of course building block one is ensuring that we have a provider community that is affirming and clinically competent. systems, the front desk person as well, just making sure it extends throughout the entire member experience. But then also we want to ensure that we are supporting members and encouraging them to be open with their doctors, so they are getting the appropriate health screenings, conversations with their doctor to ensure that they get the full care that they need and deserve as well. Because as we know, there are a lot of additional screenings and conversations that doctors and clinicians need to be having with members of our community. And if that doctor is unaware, then if they're not bringing those questions up in a kind of safe and comfortable way, then they're not going to get uncovered, leads to worse health care outcomes, or a cancer diagnosis could obviously go undetected for a number of years. We know HPV is a common, turns into cancer and is creating quite a few problems, unfortunately, for our community. So it's just one example that ensuring that both from the provider perspective and the member perspective that we're merging those two things together to create that experience.
And then the importance of building trust in therapeutic alliance. I wanted to speak a little bit about the outcomes piece, because having trust with the clinician really does affect how an individual engages with the healthcare system. And also, how to build trust. Sometimes it's as simple as being able to coach a patient about how to ask questions. That's sometimes something that we don't think about, but there's just kind of health literacy that can be missing, or just ability to engage or knowing when to follow up. And so if an individual has trust with the healthcare system, if there is a therapeutic alliance, not only will they trust that clinician more, they will then subsequently trust other clinicians more, which really speaks to the importance of a positive experience in the exam room. People will engage with the healthcare system. One of the things that we know is people sometimes, when they disengage, will only do things like go to the ER when things really get exacerbated. And so how do individuals do preventative care? How do individuals actually follow up on appointments and testing and things like that? It's through that trust and alliance that individuals have with an individual provider, and then also with kind of the larger healthcare system. And so I also wanted to save a little bit of time at the end. Each of us and each of our companies are really addressing LGBTQ plus care in kind of different and unique ways. And so I wanted to really spend some time talking through what that looks like. So feel free to let us know kind of how you're addressing some of these things.
Yeah. So again, we're a direct service provider, so we provide care to patients, and again through a fully virtual format. Maybe just to talk through a little bit about what that looks like. So we're mobile first, online, so basically you can get started with literally the click of a button, and you can learn about the services we offer on the website, and go through a digital process of filling out a health questionnaire, talking to our care team live if you have questions, and then scheduling a visit, a one-on-one video visit with a clinician who again is trained in gender affirming care. And then have your prescriptions sent to the pharmacy or sent to your home if that's your preference. And then we do regular monitoring. So we do lab monitoring every 3 months, and so we leverage Quest in their many patient service centers around the country to do that. So that's what the I guess just like structurally the patient journey looks like. But again, there's a lot of moving pieces there, right? There's a lot of things I think when we talk about trust building and how we're engaging with the community, and I think really listening and understanding what the needs are. And I think of, I've had patients tell me over the years, even before Plume, it's like, wow, I never really felt like I had a doctor listen to me before, which of course wasn't true. There's many doctors who'd probably seen this person and cared very deeply about them. But there is something that I think that can really come from deeply listening and hearing folks. And so we do that in a number of ways. Obviously, we're talking to our community regularly. We're surveying folks and understanding, just like we're talking about, not assume that this is a solution for everybody, that walking into a brick and mortar clinic might not be the best for some folks. Getting healthcare on a telephone might not be the best for some folks. And so, and then I think, again, the clinician base, right? And so I think it's very unique. We have over 100 years of experience of gender affirming care on our clinician team, which is amazing to even say that out loud. But we can do that because we are in a virtual distributed environment, and we have folks working from all over the country and training people who are coming into it who are a little bit newer to that type of care as well. And then I think the last piece is really from the research base and the outcomes. I mean, this is a unique situation where we're starting to have many thousands of patients under one roof who are trans. This has literally never existed before. And there's a lot of potential and, of course, power and responsibility that can come from that. And if you can build that trust, understanding, what are the characteristics of this community that maybe we haven't seen through some of the past attempted research that was done. And then I think that's where you can really start to change outcomes and systems. So.
Yeah, what I love hearing about this is just seeing how we're each coming from a different perspective to really solve the problem. So it definitely gives me a lot of hope and inspiration and very exciting to see the impact that our three companies have made over the past couple of years. From an included health communities perspective, the way we are focusing our efforts is to be that end-to-end support for the LGBTQ+ community from a care navigation perspective. So we partner with employers and health plans to support their employees, support their members through all aspects of care, getting connected to those right points of care, identifying providers that are right for members. But really we focus our services in three core areas. They are connect, empower, and advocate. So it's connecting our members to affirming and clinically competent in-network providers. So we maintain our own directory. We have over 6,500 providers nationwide across the 50 states. And we really focus our efforts to identify providers that members of our community see on a frequent, regular basis. So that would be primary care doctors, OBGYNs, endocrinologists, trans health specialists and surgeons, and mental health clinicians. But of course, we are there as a concierge navigation support for any provider search that a member has. So oftentimes a member will come and say, hey, you helped me find a primary care doctor, that was great. Can you help me find maybe a dentist, a chiropractor, a dermatologist, or some other doctor as well? Because it's really important that we're identifying those right providers for members. Empower is really through our dedicated one-on-one support between our care team and member, recognizing we are a very diverse community, different healthcare goals, journeys, and needs. So being able to support our members come up with those personalized care recommendations and care plans and helping to achieve those. And then our advocacy platform is really there to support our members in more lifestyle and wellness topics, because recognizing healthcare is so broad and it extends into the workplace, it extends into our homes with our families and other aspects as well. So our advocacy service is really there to support members with things like maybe coming out in the workplace, coming out to family and social groups, supporting parents of LGBTQ+ youth as well. About 10% of our members today are parents of youth. And I always think about my mom when I came out to her, really turned her world upside down. And I know she could have benefited from a solution and service like ours, maybe talking to another parent, talking to a trusted advisor, maybe getting connected to the local PFLAG chapter, something like that as well. So really wanting to be there to support the entire household, not just our individual that might be an employee or the member of the health plan, but maybe their partner, spouse, child, parents of LGBTQ+ youth as well. So we're definitely excited to see the impact that we've had in the 2 years' time that our product has been out on market, and very excited to have these two as well in their solutions, because it is making a very large impact to our community. So very happy to see.
Yeah, I think I just had a moment where I was like, wow, we're really sitting here, we're really doing this, because I think 10 years ago, maybe none of us could have imagined that there would be companies in this space, and we would be using technology to solve some of these things. And I just genuinely want to say, like, life-saving work. I know I've gotten a lot of positive feedback on both of your services. And so I wanted to speak a little bit about Violet, because we're really focused on the clinician perspective, kind of building that trust actually from the clinician up. And so we are the first platform that's ever quantifying, benchmarking, badging, and credentialing cultural competence for different communities. And what's interesting, I think, about that is cultural competence research has kind of existed for decades within the clinical academic space, and really hasn't translated so well. I mean, we were talking before the panel about anti-bias trainings and things like that, and while that's a great start, there really isn't any formal process of really understanding which communities a clinician really works best with. And then I think the other piece that's really important to note is oftentimes individuals with different identities have to really choose which one they're going to bring into a room and which one a clinician's going to be competent with. And here it's kind of an ability to really navigate multiple identities that are really important for things like healthcare outcomes. The other piece that we're really focusing on is also formalizing cultural competence training for clinicians. As I mentioned, it's a bit of a hodgepodge right now. There are really a lot of great resources, but it's hard to know as a clinician coming into the space of, oh, what is it that I have to do? And really also focusing on the introspection piece of clinicians wanting to provide this care. And I'm really excited because I think more and more what I'm seeing is this is starting to kind of enter the regulatory space. There's a lot of interest in this, in being able to provide appropriate care for different communities. And so we're really excited to be able to contribute to that. And so we have a little bit of more time. I wanted to leave time for any closing remarks.
Yeah, I mean, I think the other thing that I always think about too is not only how we're designing services, what the patient journey is like, which of course is incredibly important, and there's still a lot of work to be done there, but also how we're building healthcare companies, which again gets back to the institutional bias and forms of oppression. And I think what we've tried to do at Plume is really even try to turn that on its head as well, And so since we are really focusing on community-centered care at Plume, and we really try to have representation at all levels of the organization. And, for us, that's, we're a company of, including, contractors of upwards of over 100 people. Half the company is trans-identified in some way, upwards of 40% are BIPOC. We have trans BIPOC individuals at all levels of the organization. And it gets back to that listening to the community and understanding the needs. And I think, this is a huge mission, right? And it requires all of us, and it requires allies, and all working together. But having those voices present, weaving throughout the system is going to be really important.
Yeah, the only other thing I would add kind of in line with that is kind of this idea of, okay, so what's next? What are maybe some calls to action coming out of here? If this conversation has spoken to you, of course, I would love to have the opportunity to continue the conversation after this. Connecting on LinkedIn, Colin@includedhealth.com is my email, 1L in Colin. But this idea of continuing the conversation back in your workplaces or wherever, or within your organization, the idea of maybe speaking to your HR benefits team, partnering with your DEI group. If you have ERGs at your place of work, that is a great way to connect to those member populations that come together. So oftentimes the ERG stands for an employee resource group, but we always encourage our prospect clients and clients to build that strong relationship between benefits, HR, the ERG, and the DEI group, because it's just a great way to really understand the pulse of what's going on within your organization. What are some of those challenges? What are some of those needs? And oftentimes it just forges a really good partnership, relationship, and then really positive things come from that.
Yeah. And I just want to say how wonderful it is to be here, how wonderful it is to finally meet in person, and also just to know that there are spaces that are starting to talk about this and really creating an opportunity to talk about health equity, and also within the LGBTQ plus community. I think on my end, one of the things that I would say is just to critically engage with the norms of the healthcare system at whatever level an individual is at, because I think oftentimes there's this sort of business as is or business as usual that's really built on kind of outdated ideas and outdated models that may not actually serve the current populations, the current communities that are actively seeking care. And so how do we break out of those paradigms and start to really acknowledge that healthcare is very human, both on the patient side and also on the provider side. I think one of the things that I've seen and have felt both on the patient side and the clinician side is this sort of a clinician is a clinician is a clinician is a clinician, a patient is a patient is a patient is a patient, and you could kind of copy and paste across those. And it's actually really important to acknowledge who the individuals are on both of those sides and start to be able to better match and better understand how we kind of create an ecosystem where individuals can really be seen in the healthcare setting and thus are much more comfortable engaging in the healthcare setting.
Yeah, and I'll echo what Colin said. I would be more than happy to have conversation with folks after today, and you can reach me at Jerrica, 2 R's, Jerrica at getplume.co. Should be in the conference kind of app connector as well. So yeah, always happy to chat.
Yeah, and I'm available to connect through LinkedIn, and also KAY@joinviolet.com. I think all of us are really excited to continue these conversations, and it's been really wonderful to be here. Thank you.
Yeah, thanks everybody.